Why are my eyes so puffy? My eyes are always puffy. There are some days even more than others. They are always sensitive to the wind to the point where they tear. I do get enough sleep, and there is no change. When I squint my eyes, I can see a sac within the bag, and when I push on it, it disappears until I squint again. What's wrong with my eyes? I do not want surgery.
Thank you for your question. You've submitted 2 photos, and each photo, one is of you at rest and one is with you squinting. And you've mentioned in your question that you have some irritation related to the wind, as well as puffiness under the eyes that is variable, that there's some issues with sleep, and that when you squint, there's a bag within the bag. And the last part of your question, you mentioned you don't want surgery. So as an oculofacial cosmetic surgeon, I have a tremendous amount of experience with situations like yours. And every day people come in with this awareness and concern, and naturally nobody wants surgery. You know, people don't really come in wanting surgery, but people choose to have surgery because non-surgical alternatives don't solve their problem. So let's begin by understanding what your situation is and break it down a little bit. First of all, the bags and the sensation of your eyes are basically unrelated. The awareness of sensitivity is typically a manifestation of dry eyes and allergies. So most likely you would benefit from maybe visiting an ophthalmologist and getting an idea of what's going on with the health of your eye and not related to the puffiness around your eyes. Now, certainly puffiness around the eyes can be further enlarged from the effect of allergies, but there's no direct association between puffiness and eye irritation. So now let's look at particularly the photo at rest. With the photo you submitted, there's a bulge of swelling, which from my perspective appears to be what we call lower eyelid fat prolapse. Now, lower eyelid fat prolapse means that the fat that's normally around your eyes pushes forward and herniates. So we call that herniated fat. Now, when people have this type of situation, very often they will have good days and not so good days. In other words, in the beginning, in the early stages, people notice that there are days where they don't see it as much and other days they see it a lot. Most of the time people come to us because they're having more bad days than good days. And typically a lot of people will start their own treatment by getting topical creams and going to some of the drugstore chains or the makeup places or beauty and cosmetics places, and they'll try to get all kinds of under-eye creams, and unfortunately none of them will work because puffiness related to fat prolapse will not respond to creams. Now, some people will choose to try to get some fillers in the tear trough area or in the rim underneath the eye to try to camouflage the area. Now, that has become a little more popular than it really should be because there's a simple threshold beyond which any more filler added to that area can make the eyes look more puffy. And as far as the dynamic activity that you're demonstrating when you squint, there's a second part of the anatomy that you can be made aware of, and that is called the orbicularis oculi muscle. Now, this is a muscle that contracts, and so it's like when you contract a bicep, the bicep gets bigger. When you contract the orbicularis oculi muscle, it causes like a ridge to form, and it is a normal action of that muscle. So I think you need to ask yourself, how much does the puffiness under your eyes bother you? And as much as you don't want to have surgery, this may ultimately be the right choice for you, but I think that seeking some opinions, professional opinions, is the next appropriate step. And I think first, seeing an ophthalmologist to get a hold on the management of your eye irritation is probably the number one thing you should pursue. Ask your ophthalmologist about the puffiness under the eyes. Most likely they'll shrug their shoulders and say it's just puffiness, but at least you'll know that it's not directly related to your eye irritation. After that, based on your level of concern about the appearance and whether people are asking you if you're tired, because the puffiness under the eyes is not just an aesthetic issue. There is so much about nonverbal communications that people are aware of when their puffiness becomes more continuously manifested, is that nonverbal communication of puffy bags under the eyes is saying to other people, you're tired, you're upset, you're sad. And so that level of frustration or tired of looking tired is the most common thing that people come to us when they're ready to have surgery. So seek some opinions by qualified, experienced cosmetic surgeons. And I'm recommending surgeons as opposed to non-surgeons because non-surgeons will very often try to push you to do non-surgical procedures which may end up being ineffective or limited in the ability to deliver what you want. And don't be afraid that a surgeon will try to push you very hard. Any surgeon that does try to push you is someone that maybe is not the right fit for you. My role as a surgeon is to advise and to teach, and then for patients to make their own decisions. So, but at least a surgeon has the capability to address the full range of issues, and they're not pigeonholed or limited as opposed to the non-surgical physicians. So I hope that was helpful, and thank you for your question.